We all sometimes suffer a rough night's sleep and the next day being terrible. But imagine how miserable your life would be if this was constantly a problem. That's what it's like to live with insomnia. Many people suffer from insomnia and don't even know it. Some of you may even express symptoms. Thousands of people every year suffer from insomnia, which is why I believe it's important to educate people on it so that they can get the help that they need. When I was younger, I suffered from acute insomnia for a couple of weeks after switching schools. I couldn't eat anything, I was extremely irritable, extremely agitated, and I could not focus on anything at all. Eventually, my parents did realize what was going on and started giving me melatonin at night to help me sleep. This did help me, and eventually it did go away. I've always found psychology extremely fascinating, and disorders like this especially do intrigue me, which is why today I will be telling you the two main types of insomnia, the different symptoms and causes caused by different insomnias, and different methods of treatment. But before we get to that, I want to tell you a story about a man named Andy. Andy is a 44-year-old web developer from Bristol, and he shared his story of living with insomnia with The Guardian in 2017 when they wrote an article depicting the lives of people who suffer from insomnia. Andy suffered from undiagnosed insomnia for many years. He had to sleep with a CPAP machine and even plan his work life around his sleep disorder. It got to the point where he could no longer work full-time and had to work part-time. He began to feel stuck in his career and that he could no longer move up. To make matters worse, he hit rock bottom. He could no longer work in any kind of work environment or work around any coworkers due to his erratic behavior caused by lack of sleep. Sadly, Andy suffers from chronic insomnia, one of the two main types of insomnia, the other one being acute insomnia, according to an article by Healthline, last medically reviewed February 7th, 2019. Healthline defines chronic insomnia as a long-term sleep pattern with the trouble of falling or staying asleep for at least 3 nights a week for 3 months or longer. Chronic insomnia can be caused by nightmares, mental disorders, neurological problems, and or poor sleep hygiene. As Healthline said, there is another main type of insomnia, and that being acute. They define it as the following: a sleeping pattern where they cannot fall asleep or stay asleep for at least a few days or weeks. This kind of insomnia can develop into chronic insomnia if symptoms do persist. This insomnia is also known as adjustment insomnia because typically people suffering from it are going through major life events, such as the death of a loved one or moving. But those are not the only factors that can cause this. Other factors that can cause acute insomnia are things like jet lag or taking new medications. Luckily, there are subdivisions of insomnia. These subdivisions allow doctors to better diagnose their patients so they can seek out and have better treatment plans to better cure themselves. There are 5 subdivisions of insomnia, defined as the following. The first one being sleep onset insomnia, which is when someone has trouble falling asleep in the beginning of the night. The second one being sleep maintenance insomnia, and that's when somebody has trouble staying asleep throughout the night. The third being sleep awakening insomnia, which is when somebody wakes up before they plan on waking up, like well before. And then the third one being mixed insomnia, which is basically just a combination of sleep onset, sleep maintenance, and sleep awakening. And finally, there's comorbid insomnia, which is caused usually by mental health issues, sleep apnea, GERD, or physical pain. It's also important to note what the side effects and risks of insomnia are. They are increased risk in accidents, increased risk in chronic medical conditions, and increased risk in mental health conditions. It's important to know these risks and side effects so it can urge people to go seek help and get better. The Mayo Clinic released an article in October 2015 relaying the different kinds of treatments those suffering with insomnia can take. The first being different kinds of sleep therapy. Your doctors can prescribe you medication, or you can take over-the-counter medicine. But many people don't want to be dependent on sleeping pills, or maybe therapy just doesn't work for them. So it's also popular to try home remedies or changing their lifestyle, such as sticking to a strict sleep schedule or sticking to a strict diet. In my opinion, the most effective form of treatment is alternative medicine, such as yoga, tai chi, meditation, or taking melatonin. Knowing the main types of insomnia, the symptoms, and the treatments is important so you can regain control over your body and your mind and know what's going on. Thousands of people suffer from insomnia every year, which is why I believe it's important to educate people on it so they can get the help that they need. Insomnia doesn't need to be something you suffer with. Find what treatment plan works for you and enjoy a good night's sleep.